Everybody think that the biggest epidemic of 21st century in the world is COVID. I would say it is. There is a study in London. People who are staying in the apartments on the side of the highways, the people living there had 15 times more chance of developing stroke because of the traffic noise.
Doctor, you're also writing a book on sleep.
Actually, I had a stroke about 8 years back. Then I came to know the importance of sleep. As an ENT surgeon, lot of patients I had been seeing with snoring. That's a huge health issue. Brain is a super computer. For a computer to work, that needs data. If your 5 senses are perfect, you will be absolutely healthy.
Cochlear implant surgery, like if you have to explain it to a layman.
See, the difference between hearing aid and cochlear implant is all the disease has 3 components. One is the genetic component, number 2 is the environment component, 3 is the
Ladies and gentlemen and wonderful people of the internet, welcome to this special episode of Elsonomics. Now, I've never been this nervous before an episode, and that's because of the introduction and the list of achievements of our esteemed guest. He graduated from the Thiruvananthapuram Medical College, which was the first government medical college in Kerala. He completed his MBBS, his DLO, and then went on to do his MS in ENT or Otolaryngology. He became one of the first surgeons to successfully perform the cochlear implant surgery. In 2007, he was awarded the best doctor by the government of Kerala. He then went on to co-found the Santhwana Medical Hospital, which is a multi-speciality hospital which is specialized in ENT. He also co-founded and spearheaded the National Initiative of Safe Sound, which is a project by the National IMA or the Indian Medical Association. He was a former state president of the IMA. He is a member of the Road Safety Authority of Kerala. He is a member of the High Power Curriculum Committee for General Education in Kerala. Next, talking about the publications. Not only has he authored and co-authored numerous publications, he in fact is the editorial board member of the International Journal of Noise and Health, which is a publication that he launched and ran and eventually sold off. And now he's authoring a book which is dedicated to sleep. Without further ado, I can't wait to give a warm welcome to our guest, Dr. C. John Panicker. Thank you so much for coming to today's show.
and thank you from my side also.
So, Doctor, the speciality of ENT, with you having 50 years of experience, I know this episode is going to be an inspiration or a wealth of information for aspiring doctors, medicos, etc. But beyond that, because it's ENT, it is one of those fields that almost everyone has to interact with, right? Because of the way we breathe, the way we speak, how we hear, and a lot of the issues as well, whether it's allergies, sleeping, snoring, etc. I want to start from the basic, with the specialty of ENT, right? How has that evolved from the beginning when you started to now? And what is your vision for the future of the specialty? Any thoughts on that?
Actually, as you told, ENT is one of the commonest, the ENT diseases are one of the commonest in you take any hospital OP.
Correct.
See, ENT is covering the nose, throat, and also the ear. Not only that, also the head and neck. Initially, in the past, eye and ENT were together. It was a single specialty.
Okay.
Then only it evolved into separate.
Yeah.
Ophthalmology different, ENT different. And then now ENT has a n number of subspecialties because head and neck surgery has become a separate one.
Before I get into cochlear implant surgery, which is one thing that you pioneered, tell me a little bit about hair loss and how it impacts the life of children.
Absolutely. See, I used to say every metabolism, every activities of our life or our body is controlled by the brain.
Correct.
Including how the heart has to beat, everything.
Yes.
How the kidney has to work, everything is finally decided by the brain. And the brain is a super computer. For a computer to work, that needs data. Without data, a computer is absolutely useless.
Correct.
So similarly, brain also need data to work properly. And the brain gets data from inside the body, as well as from the outside. The inside body, it is through the sensations or nerve fibers coming from the different organ. sensory fibers. But outside data comes to brain only through 5 senses.
Yeah.
The vision, eye, the ear, the nose, the smell, the tongue, taste, and touch, skin. But out of this, actually, I would say more than 50% of the external data comes to brain through the ear. Because our language, communication, that is the thing. Even every animal has a communicating. For human being, this communication is much higher level, at a highest level. So once that communicating power is 100% dependent on the hearing acumen. So once that acumen is lost, actually the brain function is not satisfactory, slowly. So if the brain is not functioning at its correct optimum level, the brain neurons will degenerate.
Right.
And that is why long-term old age, if a person is not hearing well, that person will have more stress, more anxious, he will be more anxious, he will have memory loss, more memory loss.
Right.
The cognitive power will be diminishing.
Right.
And they will easily go for depression and other, there are even, they will withdraw from the society. So all these changes happening in the brain finally affect the other organs also.
Correct.
So indirectly that can produce all lifestyle diseases, including cardiac problem, hypertension, diabetes, even cancer. So this is the importance of hearing. I would always say, if your 5 senses are perfect, you will be absolutely healthy till probably 100 years or 110 years.
Cochlear implant surgery, like if you had to explain it to a layman,
yes.
What exactly happens
actually, we all think that hearing is by the ear.
No,
exactly, it is not true. Okay. Actually, the sound waves. We are appreciating sound waves, that is, we call it as hearing. Correct. This sound waves is a vibration energy.
It's a physical
vibration energy of molecules. That means it cannot happen in the vacuum. Correct. Only if there is a matter, the air. Either it is through the air the sound passes, or through water, liquid, or through a solid thing. But the thing is, this vibration energy reaches the tympanic membrane, diaphragm, eardrum, through this hole. This hole is called a external auditory canal. So when it reaches the tympanic membrane, it vibrates. And this vibration is conducted through 3 small bones in the middle ear. Middle ear, they are called ossicles, malleus, incus, and stapes. And this stapes is connected to the inner ear. Inner ear is a shell of bone, which is coiled like a snail. And inside that bone, there is a fluid that is called a perilymph. And inside this perilymph, there is a membranous tube. Again, it is coiled according to the cochlea. That is called cochlear. Inside that tube, there is another fluid called endolymph. Okay. Stapes is connected to the inner ear, to the perilymph area, like a piston. So these vibrations will produce the vibration in the stapes, and that will produce a vibration in this perilymph, which will again conducted into the tube, membranous tube, and the endolymph. And inside the endolymph, there are specialized nerve cells called hair cells, which has got long hairs. And these long hairs are connected with a membrane. See, this vibration will produce always a wave. It is a vibration, means it is traveling in a waveform. Correct. This wave will produce deflections of the basilar membrane. So the cell is there, hair is also there. When the deflection happens, the hair will bend according to the deflection. This bending of the hair will produce a electrical impulse inside the cell. Right. And this electric impulse, this hair cell is connected to the brain through a cochlear nerve, different fibers. And these impulses will go to reach the brain in the temporal lobe, the side of the brain. And actually the hearing, this interpretation of what vibration is reaching there is done by the brain. So actual hearing is by the brain. Sound has 2 qualities. Any wave has 2 qualities. One is its amplitude. So in sound wave, the amplitude denotes the loudness. Louder the sound, the amplitude will be more. and also the frequency, how many waves are there in a particular, in a 1 second. So actually, our hearing capacity regarding the frequencies 20 to 20,000
Okay.
per second. For example, a person who is exposed to noise continuously, they will not be able to hear the high frequency.
So people who wear earphones or
continuous earphones.
The traffic noise.
Yes.
Okay. Yeah.
But I can tell you, there is a study in London.
Yeah.
People who are staying in the apartments on the side of the highways, and they are always exposed to that traffic noise. And that study showed that the people living there had 15 times more chance of developing stroke because of the chronic noise exposure. And the commonest appreciable or measurable side effect is the hearing loss of noise.
And so, do you remember that first surgery that you had done?
Absolutely.
Right now you've done around 400 surgeries, right?
Absolutely.
Do you remember that first patient?
Absolutely. Actually, in Kerala, Dr. M.B. Manoj in Calicut, he was the first surgeon to do cochlear implantation. In India, probably, I think the early 90s, the first cochlear implant was done in Mumbai.
Okay.
Dr. Mrs. D'Souza. Because Manoj was very close to me. I was also long-time secretary of the ENT Association of Kerala.
Yeah.
At that time, the conference were ENT conference, medical conferences were only 3 or 4 in an year. So I used to attend all the conferences. See, whatever I studied in Toronto Medical College in 78 and 83, everything has changed. Yeah. And all the changes, I got the information through attending the conferences. Then I came to know Manoj is doing, went to training for on cochlear implant surgery in Germany, Würzburg. I think it was in 2002 or something. Then again in 2004, I went to another training in Australia.
Right.
Australia. That was in Melbourne. And that all this training will be for around 2 weeks stay. Started my first cochlear implant surgery. It was, I think it was in 2004. Okay. And I requested Manoj also to stand with me. The surgery is not very difficult. I had done thousands of tympanoplasty surgery, ear surgery before that. So he didn't wash at all with me, but he was just standing, and moral support, and I could do that. So that actually that patient was a Mali patient, and he was a tourist guide.
Okay.
And he fell down from the boat or something, and because of that head injury, he got damage in the cochlea.
Right.
And then he came to me, and we did the surgery. He regularly comes and meet me.
Oh, wow. Okay.
From there every year. He's absolutely all right, and he's still working as a guide.
Oh, wow.
After that. So that is the beauty of this particular surgery. And the another thing is I should tell that, see, the difference between hearing aid and cochlear implant is hearing aid is just amplifying the sound waves. Whatever sounds coming, if the person is, because of a problem in the tympanic membrane or in the ossicles, it is not properly conducted into the vibration is not conducted into the inner ear. Yes. In such cases, if you amplify the sound waves, probably a part of it will go into reach the inner ear. Then that is called a conductive hearing. But if whatever amplification is done in the power of the sound, if the hair cell is not there,
that doesn't matter.
It will not work. So cochlear implant, what they do is, see, there is an external part will be there like hearing aid. But what the operation does is, we will do an implantation, and the implant is drilled in the bone here, put an implant, and there is an electrode is there. Okay. And that electrode, we will open up the cochlea and put the electron up to the nerves. The external part, that is called a processor, hearing aid like thing. Yeah. That will receive the sound, and it will convert the sound waves into radio waves. And the radio waves will pass through the bone and reach the implant. Implant will convert this into electrical impulse, decode it, and make it electrical impulse. And this electrical impulse through the electrode directly goes to the nerve, cochlear nerve. So that is what we are doing. Initially, all these were done for adults only. A person with old age hearing loss and all. Now, so after a few years, it became for the congenitally deaf children also. So that differently change the
Changes them.
whole life of the child. Otherwise, you can imagine. See, unless the hearing is there, they cannot develop the language also. They cannot
Right.
speak. You are giving two acumen, not only the hearing,
sense,
the
but
speech
learning
also.
development
But
also.
it should be done at the earliest stage,
Mm.
at the time of developing the speech. See, after 5 years, 6 years, if you do, the speech will not be as normal as. Whereas if you do this implantation at below the age of 2,
Mm.
the speech will be absolutely normal.
Right.
Absolutely. My third or fourth child, and that child was, at that time, it was only 9 months.
Okay.
9 months and 9 days. That was, I think, 2005. That was an Indian record. That is the youngest child at that time, done by me only.
But tell us about, beyond surgeries which affect some parts, some of the most common problems that are there, especially allergies. Like, and this is something even I suffer. Like, when I wake up in the morning.
No. You are always doing like this.
So whenever I wake up in the morning, some days if I, I notice that I just go into a spell of sneezing. So why does that happen? Because I know it's a very common thing.
Yes. The commonest diseases in ENT were infections, tonsillitis.
Yeah.
Then ear infections.
Right.
Sinusitis, all this. Now the infection part is cases are very few, but lifestyle diseases are increasing. And particularly the allergic problems. And the thing is, allergy is an aberration in your immune mechanism.
Correct.
Your immune mechanism doesn't correctly work correctly. Normally, if some antigen or some abnormal protein is coming into our body will we will identify whether it is a harmful substance or a harmless substance. In allergy patients, what happens is our body wrongly identify that this is a harmful substance. Suppose a pollen grain comes. This pollen grain is normally a harmless thing, but our body is reacting to it. Abnormal identification of the antigen. That is one thing. It's a problem with the immune system, which is genetic. Number 2 is our lifestyle. Yes. Especially the commonest allergens in Kerala particularly. One is house dust. House dust, there it contains small arthropod. It is like this ticks, something like ticks, which is you cannot directly see. Maybe they're all over our body. Okay. And number 2 is fungus. Particularly in Kerala, because of the humidity, this moisture as well as the high temperature, the fungus will be very high. Then in Kerala, we have pollen grains also. That because of the heavy vegetations. Whereas in Gulf countries, it is much less.
I particularly notice it's on days when I don't get sleep.
Then it is a lifestyle also. So all these two, genetic factor, environmental factor, and lifestyle comes together, the allergy will be very severe. The lifestyle issue, number 1 is your sleep. If you are not sleeping 8 hours, that too with a good depth, that will be. Another thing is a person is getting up early in the morning.
Correct. That's exactly it. When I remember sometimes because the alarm will ring or the bus is there or someone randomly wakes me up.
Yes.
Then I wake up and I'm like, why did this
happen? That I will explain why it is happening. Okay. Sleep is very important because especially in deciding your healthiness of your immune system. Actually, I am now more specializing in sleep and snoring. As an ENT surgeon, lot of patients I had been seeing with the snoring. So that's a huge health issue. That will come.
The funny thing about snoring is all of us used to think that snoring means good sleep. Like in the videos and comics and all, they say someone sleeping well is.
Yes, it is. That is true. There is a belief like that, but it is not fact. Especially, see, the sleep issue has come in the recent few decades after the onset of electricity in our homes. Then last 10 year or 15 year, particularly after the COVID, everybody is addicted to this smartphone and iPad, including the children and even the 90-year-old persons. And number 2, sedentary lifestyle. If you are doing a proper exercise, outdoor work,
most of us are
you are always sitting inside the closed room. There the humidity will be, the fungus chance is much more. Actually, many people think the dust, external dust is the reason. No. The inorganic dust, it is actually the organic dust is the issue. It is not the dust from the road or anything producing allergy. Then, of course, your intake of water. See, I am regularly taking water. This is very important in keeping your immune system in a proper way.
Okay.
Because, see, blood circulation depends upon its fluidity. So, unless you take sufficient water, definitely your immune system can get affected. Fourth, of course, is your food habits also. Particularly, your food should contain every vitamins, every nutrients. So there are some people afraid of cholesterol, taking only this dry chapati and something like that. No, they should. Everybody should take different. There are a lot of nutrition. See, but latest we know that there are many micro elements like antioxidants. That has to be in the food. See, we didn't know that antioxidants are so important 10 or 15 years back. So even now there may be many other nutrients which we are not aware of. So this all come from different foods only. And of course, non-veg food also is very good, because particularly antioxidants, omega-3 fatty acids. Many people are afraid of taking the egg yellow. But actually, I would say yolk. That is the most nutritious food, containing lot of vitamins, particularly vitamin A, vitamin B complex, vitamin D. That particularly those who are working inside an office or something, when we check, the vitamin D level is very low. So that is because they take the white only. White contain only the protein only, nothing else. But it is contained as well as along with the essential fatty acids.
One more common thing that I think a lot of people mistake, right? They use earbuds or cotton buds. I mean, I'm saying earbuds, but they were never supposed to be used for it, is what I've heard.
Yes.
Because even in the packet, they write, do not use it internally. So can you tell about that?
See, you can ask any ENT surgeon. Are they using this earbud? I can vouch. None of the ENT surgeons are using this. Actually, these earbuds are producing more patients to us. It's very dangerous. Ear is working like an eye. If there is not enough tear, the eye will get damaged. Because the nutrition to the cornea is received from tear only. Also, that prevents any infection coming into the eye also, because it is always washing the bacteria, virus or dust or anything. Similarly, this is also a normal secretion, wax. It is not an abnormal thing. That wax has to be there. But the thing is, it is actually clearing the bacteria, preventing, it has got antibacterial enzymes also. But the thing is, there is a normal mechanism for it to come out. But when you are putting the buds, you are pushing whatever coming and that sitting in the tip of the ear, you are pushing it inside. But once that particular wax become a particular size, then the normal mechanism cannot work. And it will enlarge there, sitting there, and destroy the skin there, produce infections, produce pain, as well as hearing problem.
So it is not earbud.
It is not earbud. You should not.
It's not even.
Better not to touch put anything inside the ear. Not only earbuds, even the finger.
One more, I think, very common thing, we touched upon it a little bit, about snoring, sleep apnea, and all of that. And even vertigo. I think a lot of elderly patients.
And I think that is a big subject. See, I would say
that is also related to balance in the ear.
95% of the vertigo. Many people think vertigo is a disease. No, it is only a symptom. That's the medical term for giddiness, or imbalance or something like that. It is only a medical term. That's like fever. You say fever, headache, vertigo.
It's a symptom.
It is only a symptom. It is not. There are many reasons for the vertigo, but the commonest reason for vertigo is problems in the inner ear. All the disease has three components. One is the genetic component. Number two is the environment component. Number three is the lifestyle component. So this climate changes definitely affects. Then another thing is even the health of other animals, even the plants. See, what the plant health decides our food we are taking. So these are all very, very important. That's why the WHO, what now say is, one earth, one health. That means this is the slogan of WHO nowadays. One earth, one health. That is, the earth's health also is connected with our health.
Right. Doctor, you're also writing a book on sleep and all of that.
Yes. Everybody thinks that the biggest epidemic of 21st century in the world is COVID-19, isn't it?
Sure.
I would say it is 100% wrong.
Lack of sleep.
100%. It is the insufficient sleep along with the snoring. Snoring also is a lifestyle disease problem.
Yeah.
Actually, the people are not, even doctors are not aware of the importance of sleep because I won't say sleep alone. Sleep and the stress, these are the two things which decides your health. Then, of course, the food is there, then exercise again. But the first comes the stress and sleep. And these are inversely related.
Yeah.
If the stress is high, sleep will be down.
Yeah.
If the sleep is down, stress also will go up.
So you brought up stress, right? And that is very important because as a professional who's done this for 50 years and it's a very high stakes profession, how do you balance that?
Actually, I had a stroke 8 years back.
Right.
At that time, I was the president of the Toronto IMA,
Right.
Indian Medical Association. Normally, every day there will be a meeting, which usually finish by 10:30, 11. After that only I come, take the bath, take the dinner, sleep only after 1 o'clock or 2 o'clock.
The stress and lack of sleep.
Stress. So the stress is the single most important because, but somehow God's grace, I completely recovered from that. Then I came to know the importance of sleep. And that's why I want to write a book on that because so far there is no proper scientific book on sleep in Malayalam. Because I want to educate the Malayalis first. The name is You Too Can Sleep.
You too can sleep.
Ningalkum Oranga.
I think my last question is towards the aspiring medical surgeons, students, etc., and also in general the medical profession and policy of India. Do you think any improvements can be done? And also for the children, like what is that mentorship?
Regarding the improvements, it will take another 30 years. But the present medical education system is not at all up to the mark. One of the reasons is this entrance examination.
Yeah.
They all
mug
up as well as only the multi
MCQs.
MCQs. Because they are not learning the subject properly.
Correct.
And because of I don't blame the students because there is a high competition. I am also taking the employment. There is a IMA has got a employment bureau for doctors.
Okay.
I am the chairman for that. So thousands of medical graduates are without jobs in career.
Yeah.
See, a person is teaching 250 students in a batch.
Yeah.
How can they?
You can't even see the cadaver.
Even in private medical colleges, 25 patients would not be there as inpatients. So it is very, very difficult to. I don't have a particular solution, but it is a. But now another thing I want to tell is there are a lot of options. When we passed out, there was only two options: either join the medical college as a faculty or work in the government service or start a small clinic. But now there are many other options. You can go a pharmaceutical company, thousands of pharmaceutical companies. They are also taking doctors. Then they can go to international forums like WHO's. And there are public health and all this. So like that, there are many other options. And also the chance of going abroad also is very high now.
I think the last thing, you can look at any one of the cameras, and if you had to give one piece of advice to our audience, and this is, it can be, regarding health and all of that, but also in terms of professional excellence, because this is extraordinary, what you have achieved. And this is something that a lot of people have to learn, this level of competence and excellence. So how can someone be like that?
My advice to the public, number one is actually, you cannot buy health by some short means or anything. There are many factors affecting our health because there are a lot of unscientific ideas coming from the YouTube, Facebook and all this. Don't believe all these things because you should ask your particular doctor. Number two, as I mentioned, there are many factors affecting the. Not sleep alone will not give you a good health. See, sleep is important. Stress level is important. Your food habits are important. Your exercise is important. Your relaxation, equally important. But particularly, the number one is, of course, the stress management. If you are sleeping very well in the night, the previous day's majority of the stress will be erased from our mind. Number two, to the junior doctors, I would say, the coming up doctor, I would say, 3 qualities a doctor should have. Number 1 is hard work. When I was in the medical college studying and all these things, I was practically living in the hospital. Number 2 is your honesty. That is absolutely, because nowadays unnecessary investigations, everything is probably seeing much more. We have to think that this particular person, if he's an old man, he should be my elder brother or my father. Like that only you think, and whatever essential only you should do, because the medical economics is very, very important. Number 3, probably I would say the patients, especially for a surgeon. The patient, even if you are a non-surgeon, a physician, just hearing what the patient says, spend some time with the patient, and also with the probably, particularly if you are a surgeon, the doing surgery, if you are doing in a hurry, the chance of making complications much more. As you mentioned, in cochlear implant surgery, it's a very precision microscopic ear surgery, and any ear surgery or any other surgery, the patients is one quality the surgeon should have. So these 3 qualities, if you have a doctor, I am 100% sure you are excel in your profession. Thank you.
Thank you so much, doctor.